Good afternoon. Today we will discuss a clinical case presented in the picture. This is swelling of the penis. The swelling of the penis did not occur by chance in this patient. He came in because of chlamydia that he had independently detected in a laboratory. He had slight discharge from the penis. He took some tests, discovered chlamydia, and went to the dermatovenerologic dispensary at his place of residence. He was prescribed the drug Doxycycline in the form of Unidox Solutab. As a result, on the third day, his penis began to turn slightly red and swell, and there was slight redness in the groin area, pubic region, and scrotum. Well, he stubbornly continued taking this medication, as a result of which his penis increased in size by about 4 to 5 times. It became difficult for him to urinate because the urethra was being compressed directly by the swelling, and accordingly you can see the swelling of the penis in the picture. Accordingly, the first thing for the patient was that this medication was discontinued. Second, by the way, he took it for 7 days. Second, accordingly, tests were done for immunoglobulin E, circulating immune complexes, eosinophilic cationic protein, and a complete blood count, as a result of which it was found that eosinophils, which are allergy cells, were significantly elevated, and immunoglobulin E was also significantly elevated. Calcium gluconate and sodium sulfate were prescribed. 3 injections of prednisolone were administered. As a result, the penis returned to its normal size. In general, the slight exudation, that is, the fluid discharge that was present at the time of examination, completely resolved. About 5 to 7 days later, the penis had decreased in size by about 3 to 5 times and became normal in size. Naturally, a follow-up test was taken from the patient 2 weeks after discontinuing Unidox Solutab, but the chlamydia still remained after 7 days of taking this medication. Well, this indirectly indicates, as I mentioned in my videos, that for many people nowadays, pills already don't work in about half of the cases. There's nothing surprising about that. However, if you notice any changes in the genital area, you should definitely see a doctor instead of continuing to take some oral medications or give yourself injections, regardless of what you've been prescribed, or applying ointments, for example, and so on. And under no circumstances should you take any independent actions, because this can lead not only to swelling of the penis, which in principle is not as serious as in our case, but also to swelling of, for example, the larynx, so-called quincus edema, which can cause respiratory arrest and life-threatening conditions. Therefore, in such cases, you should immediately consult a doctor instead of persisting in taking the same prescribed medications.